The nervous system and the parasympathetic nervous system is what governs all illnesses, predominantly autoimmune problems, food sensitivities, panic attacks, because they're governed in the medulla. So the medulla part of the brain is where all these autonomic functions happen. So right before the sympathetic nervous system is developed, that happens pre-births. So when the child's in the womb, we have these important reflexes called the fear paralysis reflex, which is the freeze response. And the reason why we have the fear paralysis reflex and that parasympathetic nervous system inhibits this freeze response. And the way it does that is by something called the dorsal motor nuclei. And that has to develop within birth. Now, if the mother's in a state of stress, that baby has to align itself to what it believes it's coming out to in the world. So this is why it's so important, and this is for all the men out there, to treat the women well when they're in pregnancy, because the less they can feel stressed, the healthier that child will feel, because we then get this development of the fear paralysis reflex in the correct way. Once the dorsal motor nuclei develops, it then develops into the sympathetic nervous system, which is the fight and flight response, which is a really important nuclei called the rostral, lateral, ventral, medulla nuclei. Now, when that develops, that then develops this fight and flight response, which we refer to as the Moro reflex. And then if that's developed healthy as well, then it develops into a year to 18 months, it develops into what's called the nucleus ambiguus. And this is when the child is born and it comes out, it goes into these three stages, and they're responsible for our fight and flight response and freeze response, the sympathetic nervous system, which governs the fight, flight and freeze, and then the parasympathetic nervous system, which governs the rest, digest and growth response. And it's to do with these three nuclei, and if they don't develop, especially that last one, parasympathetic, because that is when the leaky gut starts to close, because it's absorbed all this immunoglobulin from breastfeeding or from the nutrients of the formula milk. And when that closes, then we get this amazing synchronicity with digestion and the immune system. But what we don't know, and what most people don't talk about, is there's a lot of individuals are in sympathetic states of stress, and that leaky gut hasn't closed, and later then they get diagnosed with celiac disease, they get irritable bowel syndrome, anxiety, and it's all to do with governing this balance between the sympathetic and parasympathetic nervous system.